Good afternoon, everybody. Welcome again to another episode of our June's Updates. Follow along via, let's see, I'm gonna use a green lightsaber this time. So we're gonna be focusing on patient workflow, staff workflow, we're going to revisit some of the PPE guidelines, and we're going to be looking at some of the protocol enforcements for COVID-19 once we redo open again. And again, like I said, opening day really depends on the COVID-19 statistics in Monroe County. As of now, based on projections, the number is still too high, but that can change any day, and I'll keep you guys up to date on that. So for the patient workflow, the 3 days prior to surgery, the patient will go to the closest COVID evaluation tent prior to 11 a.m. for testing. Every patient that's going to have an elective surgery here and actually going forward, urgent surgery, will have to be tested for COVID-19, and it'll have to be done 3 days prior. So this is going to be instituted by the provider. They're going to be calling this number to let the evaluation tent make them aware that a patient is coming to be evaluated for a elective case. 1 day prior to surgery, our H&P nurses will be checking the COVID test results to ensure that they are negative. Any positive results will automatically cancel the case, and the H&P nurses will also instruct the patient on what will happen the day of surgery in regards to the protocol. So, for example, they'll let them know that they have to take a temperature that day, and if any temperature of 100 and 100.0 and above will automatically cancel their case. They will let them know that visitors will not be allowed, that there's going to be some impact on the flow as we limit the number of patients that are coming in the facility. The day of surgery, step by step, patient will arrive and be screened through the main entrance. You can see this is the main entrance door. We have this little setup here that'll have masks if the patient does not have a mask or a cloth mask covering their mouth. They'll be given one, so they'll be screened. Registration is done while maintaining social distancing. You can see that by the X's and this divider that's dividing the two registration desks. So the X's are we mapped it out so they're 6 feet apart. After registration, patient will be escorted to pre-an to be prepped, or they will wait in the waiting room. The waiting room has been taped off to allow only 8 folks to be sitting at once. Any number above 8, they'll have to wait in a car. And we're also working on a program that has some automatic texting for the patient to let them know that they're ready. More to follow on that. So once they're brought back into pre-an, the surgeon and anesthesia will visit them after the pre-op nurse preps the patient and whatnot. And as stated before, the patient will have their mask on throughout the entire time. Once they're prepped, the surgeon and anesthesia will visit them to complete their checklist and verbal consent and answer any of the patient's remaining questions. The RN circulator will visit them with the patient to complete any necessary items prior to moving the patient to the OR. Like I said, the mask will be on, and once it's removed from the patient, it'll be placed in a baggie that's going to be attached to the stretcher. Patient will have their surgery. RN circulator and anesthesia will do their recovery and PACU and sign off report as normal. PACU RN will do their admission to the post-op care, and they'll complete it. The driver or the family will be called and made aware of the patient that they're ready for discharge. Discharge instructions will be communicated to the driver and family. The driver and family will be instructed to pull up to the discharge door. Once the discharge instructions have been given, IV will be removed. Patient will be instructed to get dressed. And then the patient will be taken to the discharge door via wheelchair by either the tech or the nurse. For staff, I've placed signs throughout the entire facility to direct everybody to the main entrance. As you can see here, there's some signs in the locker room downstairs that are stating that entry is prohibited, to report to the main entrance to be screened. So again and again and again, if you want to make the process easier, please go to rhdailypass.org.com, complete your questions, show the screener your cleared for work screen. You'll get a pink sticker that's going to be attached to your badge, and you'll be cleared for the day for work, and then from there you'll enter the surgical suite. Friday last week, we got our PPE, plastic face shields, and N95 respirators. So I want to go over some of the guidelines here just to kind of clarify any type of confusion or answer any type of questions you may have, specifically focusing on the plastic face shield and N95 respirators. The plastic face shields are only to be used really to keep the surgical mask from being contaminated, and so it lasts for that week. You don't have to wear it at all really in pre and post. As you can see, it says it's recommended to be used with non-COVID patients. Now, are you able to wear it between patients? Yes. Can you clean after use? Yes. In the operating room, the N95 masks are to be worn in the OR only during intubation and extubation cases. So patients who are receiving general anesthesia, to be worn by all members in the operating room. So that's your surgeon, your surgical tech, your circulator, your anesthesiologist, anyone in that room that is going to be present, obviously, during intubation and extubation. And if that's not going to be the case, then whoever else joins the room has to wait 20 minutes prior to entering the room. So again, the plastic face shields are recommended. If you take one, please let me know. I'm documenting whoever has taken one. And the N95 masks are only for the OR folks who are going to be in a general anesthesia case for any type of aerosol procedures. Now, if a pre-post nurse or a PACU nurse is going to be giving a albuterol treatment, which is an aerosol intervention, then they would have to wear an N95, I would assume, as well. I'm still clarifying that, but I don't see why not. For now, let's just say that for the PACU nurses who are going to be giving albuterol treatments, let's just be safe and have them wear the N95 mask as well. Now, I'm going to be focusing on some of the protocol enforcements that are kind of be unique to our center for COVID-19 guidelines. These are going to be interventions that are going to be taking place once elective surgeries begin. Some of them have been taking place with some of the cases that we have done this week and next week as well, but we're going to be having one empty bay in between patients just to kind of ensure that, we're limiting capacity, social distancing is being maintained. Local cases will also be scheduled 20 minutes apart as well. So again, this is to limit the amount of folks coming in, to ensure that there isn't a lot of folks waiting for their case, to limit the number of people in the waiting room too. No visitors. One provider is going to be given a bay, an OR, or a procedure room. So we're not going to have cases or providers initially operating in two rooms. Also not going to be giving two bays to be working from, as our bays are going to be limited due to this plan that we have where we're going to keep one empty bay in between patients. And then during the discharge process and the provider, if a patient is ready for discharge, they will be discharged. We will not wait for a provider to come out of the room. If there's an order, if the patient is ready to go, we will be discharging them. That is really all I have. I hope this video was helpful. I'm going to be attaching an image of this page as well too, if you want to use it as reference. If you guys have any questions, please always contact me via text, email, phone, and I'll do my best to get back at you as soon as possible. Thanks, everybody.